Serious. Doctors have read it. What is the rarest disease that you've encountered in your career? Dermatologist here. Some fun ones. Chrome hydrosis, where sweat comes out in different colors. My patient's was blue. Argyria, a permanent discoloration from silver overdose. Aquagenic urticaria, an allergy to contact with water. Pseudocyesis or hysterical pregnancy, in a woman who was an inmate in the psych wing of a prison I rotated through. She thought she was pregnant with Jesus's triplets and had grown a massive pregnant-looking belly, was producing milk, etc. Gorham's disease aka vanishing skull syndrome. A softball-size area of my patient's skull disappeared and left behind a soft spot. She ended up with a plastic plate to protect her brains. Crazy disease. Actual scurvy. Poor old man didn't know how to cook after his wife died and ate nothing but biscuits. Fibrodysplasia ossificans progressiva, FOP. A disease that calcifies soft tissue and turns it into bone. When I was a medical student, our group's cadaver had this disease. During dissections we sometimes would get poked by spiky pieces of bone in random areas of her body. Also had a spine that resembled a small turtle shell. Walking corpse syndrome, Cotard delusion. 17 years in mental health and I've seen it once. The belief that some or all of you is dead. The guy was so certain he was dead he believed he was a zombie. Persistent genital arousal disorder. Having multiple orgasms a day, at any time, without any stimulation. Becomes quite bothersome and uncomfortable, limits your daily activities and sleep is interrupted. Over time patients can become very hopeless. It is remarkable the dissonance between the name and the obvious joke, and the tremendous suffering these patients endure. Harlequin ichthyosis. In med school there was a baby born with this. Basically their skin scales up and peels, removing that very important barrier, so kids born with this don't live long. She was just a couple months old and had not yet left the hospital since birth. Maybe not the rarest, but saw a 4-5-year-old patient with Lesch-Nyhan syndrome on my PEDS rotation in med school. It's an X-linked recessive disease that a quick Google search tells me affects about 1 in every 400,000 individuals. It's due to a mutation in an enzyme involved with DNA recycling. The thing all med students remember about it is for whatever reason these patients have a tendency to self-mutilate. My specific patient had to have a procedure to have all his teeth removed because he would terribly bite his arms unless he was physically restrained. I believe he had an older brother that went through the same ordeal. So sad, but definitely one of the more memorable cases from med school. Rarest disease that I've seen in my career thus far would have to be leprosy. It's something that one hears about in antiquity and something I read about in books, but I never expected to actually encounter it in my career. The rarest I've encountered is kid syndrome, keratitis ichthyosis deafness. A 5-year-old, very sweet, blind girl who literally had rough, thick, opaque skin on the surface of her eyes. Ob here. Seen a lot of strange things, but once delivered a pre-viable baby that had cyclopia and proboscis. Didn't know beforehand, so was pretty shocked. Psychiatrist here. Anti-NMDA encephalitis. As seen on the movie Brain on Fire. About 2 cases per million per year. I've actually seen 2 cases 12 months apart. Alpha-gal tick-borne disease that makes you allergic to red meat. Spongiform encephalopathy, Creutzfeldt-Jakob disease. Malignant hypothermia in my 11-year-old patient. I was only in my 2nd year of anesthesiology residency and I thought she was going to die. I had a salty old anesthesiologist as my attending and she calmly led the whole team through the treatment. My patient did great and her labs were all normal when I took her to the PEDS ICU. I couldn't sleep for 2 nights and still haven't gotten over it. Ob-gyn here. Him probably conjoined twins, thoracophagus, and a couple of cases of complete androgen insensitivity syndrome. My colleagues had a patient with catecholamine-induced ventricular tachycardia. aka every time this 13-year-old exercised vigorously or even got too scared, the adrenaline would induce a deadly arrhythmia that needs to be shocked before long in order for him to survive. Seriously. On my OB rotation during residency, I helped deliver a baby who had spots all over. Further blood testing revealed the baby had developed leukemia while in the mother. Didn't know that was really possible prior to that day. Incredibly rare. Probably not the rarest I've ever seen, but Fournier's gangrene comes pretty close. Only saw it once in my career. Don't look it up if you value your stomach contents. Goodpasture's syndrome, incidence rate of 1 in a million. Autoimmune condition that affects the lungs and kidneys. 30-year-old African American in active labor with about 5 family members around her. I am the pediatrician at bedside waiting for the baby to come out so I can examine him. He comes out and all of his poor little distal limbs are severely disfigured or missing digits. Turns out he had intrauterine amniotic banding. Pieces of the amniotic sac get wrapped around limbs and digits. This causes strangulation of the blood flow and prevents development. Worst thing I have ever seen and 1 in 1 million chance of happening. But Mom took him in her arms and loved him all night long as if nothing was different about him. Patient here had Stevens-Johnson syndrome, incidence rate 1/2 million, as part of an acute reaction to an antibiotic. Every time I mention that I had SJS to a friend in the medical field, their eyes go wide and they go, "Really? I've never met someone who had that." Almost giddy. Med student here. This happened in my first year of med school, when I was learning physical exam maneuvers. We learned to examine from the patient's right, but in this case, the senior medical student in the room with me was at the patient's right. I started auscultating the standard APTM spots for the heart, but I performed him from the left side. When I had concluded the exam, I said I heard normal heart sounds. The senior student told me that I had auscultated in the spots opposite of where I should have. He then performed them properly and looked puzzled when the heart sounds seemed displaced. It turned out the patient had dextrocardia. Rare and interesting would be pathology of Cantrell, which has the heart outside of the chest because the sternum has not fused. I'd seen it before with just a bit of the heart on view, but with this kid it was completely out. You could see pretty much the whole heart with the aorta and lung vessels all that was holding it, the heart just beating away. I'd done adult cardiac for a bit, but this was a little different. Tiny. We covered it with a polystyrene cup, until the kid went or theater to have it pushed back inside. It's meant to be 1 to 65,000 live births. When I was in nursing school I took care of a woman with fibrodysplasia ossificans progressiva. Basically your muscles slowly calcify to bone, and every injury, even small ones, speed up the process. She was pretty much wheelchair bound and needed 24-hour care. Kawasaki's disease, and this was 25 years ago when even less was known about it. Have to give credit to a young cardiologist for confirming it. Necrotizing fasciitis, i.e., flesh-eating skin disease. Terrifying. Rarest? Off the top of my head? I don't know. I did see a woman with psoriatic arthritis type 5. It's an autoimmune disease. It had basically disintegrated all her fingers to nubs. They had the exact shape of short, stubby sharpened pencils. Edit. I think it's called distal interphalangeal predominant psoriatic arthritis. And the pics I googled still don't do it justice. She looked like she had sharpened pencil stubs for fingers, like strange little claw hands. I was an intern at the time. The woman laughed at my amazement. She was obviously comfortable with it at this point. Edit. I got the precise name of the disease wrong. Somebody below pointed out to me that it's actually a more severe form called psoriatic arthritis mutilans. Nursing student, but scurvy. We don't see it very often because of the widespread of vitamin C in most foods. Patient had OCD plus agoraphobia, making their diet extremely limited, and never left house, so mostly noodles and instant ramen 1 meal a day. Was eventually found almost dead with no teeth by a wellness check when neighbor thought he was dead after not hearing him moving around flat in over a week. The rarest case I have encountered was a patient with a cold who understood that antibiotics would not cure it, so they didn't ask for it. Never saw another case like that again. CLN6, only about 125 cases described in the literature. My brother has the disease and I am a carrier. His diagnosis was unknown until I had extensive genetic testing done prior to fertility treatment and found I was a carrier. I'm also an IM doc, driven initially by my desire to figure out what disease my brother had. I have seen VCJD. There was a small cluster at a hospital I trained at thought to possibly be associated with wild game. I also had a patient with Lee syndrome. Pathologist here. Rare diseases for most other doctors are commonplace in our field. I've diagnosed multiple leprosy cases and rare cancers that have only a few published cases in the literature. Some are so rare there aren't names, and we just describe the cancer. Intellectually challenging for us, terrible for oncologists who might not know how to treat that entity. A Margolin ulcer. It's a type of cancer that grows on damaged skin, mostly burned skin. I handled a patient with one on junction where her neck and back met. I was the anesthesiologist, and the patient can't lie down flat due to the pain, which made placing an endotracheal tube way more difficult. This is a picture of the patient NSFW. Hutchinson-Gilford progeria syndrome. Takotsubo syndrome is a woman was at her husband's funeral. Stiff person syndrome. I only diagnosed the Takotsubo, but was on the team in the early treatment of the other two. Stiff person was idiopathic as far as we could tell. During an acute attack it was a real bugger to treat. There's very little literature or guidance. Nurse here. I've unfortunately seen fatal familial insomnia. Also seen Brugada syndrome. Edit. Also seen neck FASC a bunch, transient global amnesia, good pastures, Stephen Johnson syndrome, psychopathy. I guess I didn't see it. Some other unusual stuff that isn't coming to mind. Nursing can be a shit job, but you get some cool stories. Not that rare but very creepy was side neglect after a stroke. The person completely forgets that there is more than one side to their body. They will brush only half their hair, do makeup or shave half their face and use only one hand. If you put an object into the hand on the neglected side, it is as if it disappears for them. And it's not paralysis, they are able to move that arm, it's just to them, that half of the body does not exist. Strokes are fascinating actually, or rather our brain is. You can be fully paralyzed from a tiny stroke in an important brain area, or you can have a huge stroke in a non-important area and be totally fine. Two fun diagnoses I made as a hospitalist were scurvy and Goodpasture syndrome. Clinical lab scientist here, doing the testing. I once saw mold growing from a brain tissue patient was immunocompromised. He eventually died but not before pretty much every piece of tissue submitted for culture grew fungus. The type of mold growing was common environmental flora, Alternaria species. I'm a patient, and I was diagnosed with WPW after a brutal hit to my chest, while playing football. It took 2 catheter ablations to correct the problem. Both doctors and the hospital staff have never seen anyone diagnosed with WPW in their teens. So I was recovering around people in their 60s and 70s. It was a life-changing moment. If you're a cardiologist in Northeast Illinois, McHenry, Lake and Cook County, you may have saved my life. Thank you all and Godspeed. Complex regional pain syndrome. Essentially in this case they got a sprain, and it resolved. Unfortunately the brain has decided that the affected area needs defending and sends severe pain signals 24/7. Terrible disease that's incredibly difficult to treat. Also has a tendency to spread. A toddler was brought into the ER for a large hand burn. He placed his hand on a radiator and kept it there until his hand got a second-degree burn. The thing was he didn't cry until his mom freaked out about it. And he didn't cry when I was cleaning his blistering wound. Turns out he doesn't feel pain, congenital insensitivity to pain. He was an adorable kid. I was diagnosed with a chordoma 8 years ago. 1 person in a million gets it. I tell people if you have to get cancer, get one of the common ones, treatment is way better. I am a ER nurse and was able to witness a case of advanced Fournier's gangrene. That was the wildest thing I have ever witnessed. Keep the sick bag close when you look that one up. Really appreciate these answers. If you're using big words, feel free to elaborate on what it actually is for those of us who skipped med school. Thanks. Dissociative identity disorder, otherwise known as multiple personalities. I'm not talking about more common dissociative symptoms seen when people have borderline personality disorder, or malingering, when someone attempts to behave as if they have multiple personalities. I'm not even talking about conversion disorders. I've come across a couple of rarer conversion disorders at one time or another. Dissociative identity disorder is controversial, with some debate on my field about whether or not it is real, especially when it comes to very distinct personalities that do not share memories and may be very different from one another. Until the day that I saw it in person, I was quite skeptical. Not anymore. Reading this thread, you doctors are freaking amazing and seriously, what would the world do without you guys? Methemoglobinemia, Proteus syndrome, child syndrome. Also once sewed up a wound from woolly mammoth bite. Paleo grad student tripped and fell into a bone reconstruction table. Needed stitches. Nurse here. Cared for a patient who was the victim of Munchausen's by proxy. Isolated laryngeal tuberculosis. We thought she had sarcoidosis until we did the DL with biopsy and debulking. She had no risk factors, but lo and behold. My anxiety is telling me not to read any of the comments and my curiosity is asking why I have to be such a baby.